We would like to treat an oblique shaft fracture of the radius using the small fragment instruments and the principles of axial and interfragmentary compression. For this exercise, the distal fragment is placed in the holding device. The small fragment instruments are burnished brown to allow easy identification. For the forearm, we should choose at least a 7-hole plate in order to definitively engage 6 cortices in each fragment, 3 holes in the distal fragment on the right and 4 in the proximal fragment on the left. To begin, we plan the placement of a neutral screw in the distal fragment in order to close the fracture line. The second step involves the placement of an eccentric screw in the proximal fragment. By tightening both screws in an alternating fashion, we produce axial compression into the axilla created by the fracture apex and plate. In the third step, we join both fragments with an oblique lag screw and in so doing obtain additional intrafragmentary compression. The remaining screws are then placed in a neutral position. The radial aspect of the intact radius is convex. The plate should be placed on the radial aspect, as the surgical approach to this reason is the easiest. For this reason, the plate must be contoured. We model the aluminum template to the form of the radial convexity. In order to contour the plate in the form of the template, we will use bending irons as shown here. We will overcorrect the contour of the plate somewhat in this middle portion in order to increase the compression between the opposite cortices. Here is the template in this slightly over-contoured position with the plate. A small gap between the plate and the bone can be seen. This will be the position of our interfragmentary lag screw. To begin, as depicted in the drawings, with the plate in position, we drill a neutral hole into the distal fragment, close to the fracture line. We use the 2.5 drill with the green neutral DCP drill guide. We measure the necessary length of our screw. We then tap the 3.5 thread using the tap sleeve. You must reverse the tap occasionally in order to clear bone chips from the teeth of the tap. We can now insert the selected screw. It is not yet tightened. The second screw should be inserted into the proximal fragment in the eccentric position. The yellow eccentric DCP drill guide is used with the arrow pointing towards the fracture. The hole for the planned lag screw is left vacant at this time. We measure the length of the hole and then tap the threads. The screw is inserted and tightened along with the first neutral screw in an alternating fashion. The fracture fragments can be seen to approach one another, the fracture gap narrowing on the far side of the fracture first. In the third step, we drill the oblique 3.5 millimeter gliding hole for our lag screw through the cortex underneath the plate. The round 3.5 drill sleeve is used. Into this hole we insert the insert drill sleeve and drill the 2.5 millimeter hole in the opposite cortex. In measuring the length, the hook should engage the opposite cortex with the hook pointed towards the fracture line. We tap the threaded hole using the 3.5 millimeter tap and its sleeve. By tightening the lag screw, we produce interfragmentary compression and thereby close the fracture gap between the two cortices and the gap between the plate and the bone as well. We place the remaining screws in neutral position using the green drill guide and insert the screws in an alternating fashion. We must engage at least 6 cortices in each fragment. In the axial plane, the screws should diverge slightly in order to be certain that the screw tips do not protrude through the opposite cortex in a single line. This minimizes the chance of a crack occurring through the screw holes. We can now remove the reduction forceps. The screws should be retightened in sequential fashion and in the same sequence in which they were inserted. In this way, the radial shaft fracture is stabilized. Viewing the radial fracture opposite the plate shows that the screw tips are staggered in order to avoid a fracture through the holes. Sometimes the fracture line will not allow placement of a lag screw through the plate. In this case, an independent lag screw is necessary. The fracture is reduced and held in place with a pointed reduction forceps. Then a 3.5 millimeter hole is drilled. Following this, the 2.5 millimeter threaded hole through the opposite cortex is drilled. The countersink should be fully turned in one direction to avoid an irregularity in the cut. We measure length and tap as before. Finally, we tighten the screw. The obtained interfragmentary compression is protected by means of a radial 7-hole neutralization plate, which is not pre-bent and in which all screws are placed in the neutral position.